For those of you who didn't know, in 2005, I suffered a massive stroke. It took me years to recover. When COVID showed up in 2020, having this underlying condition made things that much more concerning for me. And that's why I made the choice to get vaccinated. Now, I'm not here to tell you what to do. I can only tell you what I did. I can also assist with getting out good information that can help you make the best decision for you and your family. And along with my guest today, that's exactly what we're going to do. Dr. Michael Howell, thank you so much for being with us. And happy Saturday.
Thanks, Mark. I appreciate it. And you, Dr. Mike, it's fine.
Thank you.
We're glad to be here, and I appreciate you taking the time just to chat.
You have worked with local Black medical society to create digital media addressing vaccine misinformation. Tell me about the misinformation you found and how do you address it?
Well, one of the things that we found is there's so much noise out there in the news and the facts that it's really created a lot of confusion for folks. And I'll tell you, it's created confusion for folks that look like you and look like me. Now, it's also created confusion in other ethnic groups as well: white, Caucasian, Hispanic, Latinx, American, indigenous population, Asians. But it's really important that we figure out how to address that among Black African Americans. And if you can't do it everywhere, do it where you can. So I decided that in the midst of all this, we had to do something. And I decided to go ahead and just start figuring out ways to talk to the community and communities, if you will, of people in Central Florida about what was going on.
And what do you tell them?
I tell them that this is a virus that is killing people, and it doesn't care about your politics, it doesn't care about your religion, it doesn't care about your race, it doesn't care about anything about you. If you get it and you don't have some form of protection, there's a strong likelihood that it's going to make you significantly ill or seriously ill, requiring hospitalization. And if you find yourself in a hospital, sometimes you don't come out, you can die.
I have been vaccinated. You have been vaccinated. Do you tell them that you agree about vaccination, they should get one?
I tell people you've got a couple of choices. You can get vaccinated and have your body create an immune response to keep you from getting severely ill, requiring hospitalization and possibly dying. Or if you just refuse to get vaccinated, you've got to play by the rules that the CDC has set to prevent you from getting infected. That's using a proper face mask, wearing it properly, performing proper hand sanitation, and definitely staying out of the midst of crowds who are of people who you don't know their vaccination status and who are not protecting themselves, where you could possibly become infected.
Mike, you've been an MD for over 20 years. What have you learned along the way?
I've learned that in the world that we live in now, there is access to care. But people need to know that they have the right to good health, quality health care. And people, Black people, people of brown color, need to recognize that how healthcare works and how to take full advantage of it. We've got to dispel some of the isms that we've carried with us over time. How we treat certain conditions or how we ignore other signs and symptoms of disease. What I've learned is that if we act proactively, if we look to live preventively, we can live as long as our non-Black counterparts. But we've got to get our heads out of the sand. We've got to stop believing everything that people say. We've got to read and make sure that we become scholars. We don't have to be huge scholars, but we've got to know the facts about hypertension and diabetes. We need to know the facts about heart disease and what impacts us as a people. If we do that, I think we can move forward as a people. We can't let this pandemic, if you will, stop all of our advancement and push us back, which it has. It's taken our life expectancy away. We need to do everything we can now, double time, to get those years back and the leapfrog into some gains, if you will.
Let's get back to the variant, COVID-19. Have you seen the clip from the Alabama governor?
I have seen the clip of the governor. I've also seen clips of other governors and high-level politicians who talk about the variants.
She said, it's time to blame the unvaccinated people. Your thoughts?
You know, we live in a society and in a time where we're blaming people for everything. And then once you get blamed, then we kind of cancel you out, if I can use that term. I think the people who are unvaccinated have made a personal choice at this point not to receive the vaccine. Is it the right choice? Well, if you're lucky enough not to become exposed to the virus and get infected, maybe it was the right choice for you. But if you get exposed to the virus and you get severely ill and possibly even die, it was not the right choice. So I will tell you, I'm not going to blame one side or the other. I think we need to help educate those that have decided that the vaccine at this time is not for them. I understand the reasons why people don't want to get vaccinated. There's some who just say, I'll never do it. There's some who are waiting for FDA full approval. There are those who are waiting for their family members to kind of tell them that they should, or other influencers to tell them that they should get vaccinated. I'd rather work with people where they are and say, look, for your health, for your safety, for you, your family, your community, we've got to make decisions based on facts. And the facts as they stand right now is that the vaccine helps prevent us from getting very, very ill and dying. That, to me, is the only choice that I want you to make.
You answered the question I was about to ask about a podcast with Magic. You were on that podcast discussing COVID-19 minority populations. What did you do on his podcast?
We took the opportunity to use his influence in the world to talk about how we can raise the level of equity in communities that have been disparaged over time, and to raise the level of awareness for conditions that really hit those particular communities. And that conversation really talked about minority women, minority men, minority communities, to make sure that we told them that there are things that we can do to save ourselves and protect ourselves, and making sure we understand the vaccine and doing the things that prevent us from getting infected, sick, and die, or some of the other learnings that we tried to share in that particular conversation.
Mike, I want to thank you. You speak around the country. You speak via Zoom to people who look like you, look like me, about choices they can make, choices to be healthy. When you tell them that, A, what do you tell them? And B, what is their reaction?
I usually ask people, are you vaccinated? And I get a variety of responses. I love it when I get the response, yes, I am. But when I get a response as to, no, I'm not, I say, cool. So what keeps you from getting vaccinated? And I'm looking for what they tell me and how I can respond in a way that helps to take away that mistrust, that disbelief, that confusion, that lack of information. If I can find out what's their reason and then solve for it, I can get them to consider another option. Give you an example. Recently had a birthday. My wife decided to have some friends over. The only person there, we had one person there who was not vaccinated. And he's one of my best friends. People keep this information to themselves unless you ask them. So I asked, are you vaccinated? He said, no, I'm not. And I asked him why. And his response was solid. He said, I'm not vaccinated because every time you come up with the first edition of something, you always kind of want to wait for the next edition of because it's better. And I said, now that's one of the better responses I've ever gotten. I said, but let me tell you this. This Delta variant is killing people, and it is much more potent than the original coronavirus that hit the world. As your friend, as someone who cares deeply about you, I want you to consider the science. It's safe, It's effective. It's been used by hundreds of millions, if not billions of times around the world and the globe. People are not dying from the vaccine. They are, in fact, dying from the virus and its complications. I want you, my friend, to consider getting vaccinated because I don't want to see you die. I texted him a couple days later because, unfortunately, one of my close neighbors, a good friend, was in the hospital battling COVID-19. And he was battling it because he did not believe that the virus was real and that he should take the vaccine. Very good friend. I texted him and said, my friend, the guy you know, just died from complications of COVID-19. He texted me back a picture of his vaccination card. I said, thank you, brother. I love you. And he wrote back to me, texted back. He said, thank you, and capped you.
Nice.
And I said, you know what? I just saved one starfish on the beach. I've got more to save, but you know, we need to get out about the business of saving every starfish on that beach. If we do that, it won't be that we left so many there to die. It'll be that we got so many back into the sea and they lived.
Love that story. Love that story. Mike, I'm going to change a bit. I'm a member of Cigna. My healthcare is through Cigna. Tell me about your involvement with Cigna.
Well, I'm a regional medical executive for Cigna for the Southeast U.S. I also manage as a medical executive North Florida, Central Florida, and the U.S. Virgin Islands. Cigna has allowed me the opportunity to work within communities to help empower them to be able to work with health disparities, gaps in care, meaning the things that you need to do to take care of your hypertension, your diabetes, your heart disease, etc. Cigna continues to find ways to integrate the technology that it has into the community and with the physicians and other providers in the community to make sure they have the tools that to be able to take care of folks in those communities. So I really am proud that I'm a part of that organization and that they're allowing me to use my skills and my talents and my message to be able to get to other folks. Now, what I've been able to do in my role at Cigna is to reach out to the various employer groups that we service and serve. And those groups have allowed me to create presentations that talk to them in town halls, via Zoom or Microsoft program, and allow me to share with them what the things I know about the virus, the things they can do to protect themselves, to be able to answer their questions. You would not be surprised the number of questions people have, the number of conspiracy theories that they ask me about. And I get a chance to say, you know, that's a good question you have, that's a good point. I said, but you know, when they say they put a microchip in the vaccine, I say to them, well, why do they need to put a microchip? The government needs to put a microchip in the vaccine. They've got your cell phone. I can find you and hear everything. You know, and they say, you know, you're right. Or when we talk about the vaccine in those audiences of what it can do to my DNA or not, I can explain to them the mechanism of the messenger RNA vaccines. I can talk to them about the side effects and talk about the latest things in the news about whether it affects the heart or whether it causes blood clots. That's the value of being with an organization that allows me to speak freely but factually to the people that we serve. Our goal at Cigna is to make sure that we improve the health and well-being of the people we serve. And I'm just happy that they let me get out here and do that.
You're a good man. Good man. You were the recipient of the 2021 Alfred Burkhart MD Award for Health Equity. What is that, and why did they give it to you?
Why did they give it to me? That's a good question. Dr. Burkhart was a surgeon in this town and helped found the Central Florida Medical Society. It's a component society of the National Medical Association, and it is the African-American-based medical society here in Central Florida. There's some around the country and various other cities. And what we do is to work with providers, black providers, but black and brown providers, if you will, in our community to continue to raise an awareness for what we can do to help raise the health and status of people of color in the community. I believe that the committee that looked at applicants for that particular award just took into consideration what I had been trying to do, raising the awareness for COVID-19. Now, I'm doing that, but I'm also talking about bias in the medical field, bias in the healthcare workplace, and trying to raise an awareness that how we are treated in hospitals or how we receive health care, even addressing the Tuskegee syphilis experiments and of the Guatemalan syphilis experiments and other types of activities that have gone on in the past, helping all of medicine and society understand there is bias out there. And once you recognize it, you can actually effectively start to neutralize it. But you've got to own it, and you've got to have a desire to change it. So I believe they took that into consideration and felt that this year I represented that, and that they decided to go ahead and recognize me for the efforts that we were putting in. I had no idea that was even out there. I don't do this for any recognition. But somebody's got to get out there and create a band, if you will, that's going to start carrying this message. There's too far few of us out there. I'm sorry to say this, but we should have black physicians and brown physicians around this country carrying flags, dispelling the myths and mistruths about COVID-19 and the vaccine. We should have black and brown physicians and other healthcare providers around the country talking about how do we improve the health and well-being and status of people who have diabetes and hypertension and heart disease, and talking about how we start to break down those barriers that keep us from getting the type of care that we need in healthcare to live longer. I'm tired of being told that I'm going to die sooner than my white counterpart or my other. I want to gain back the years. And you know what? COVID actually took 2 to 3 more years off of the black man's lifespan. I want my time back. And I want your time back. And I want to make sure that we're doing and saying everything we can to get our lifespan back.
Dr. Mike, you're working with other physicians to create a video series. Tell me about that.
Mark, when I use the analogy of the starfish on the beach, I found that I can't do it all by myself. And I'm not. There are lots of other good people out there, lots of great folks here in Central Florida who are doing some similar work. But I asked the Central Florida Medical Society doctors to consider making some 2-3 minute videos to start to speak to various aspects of how we can start to protect ourselves and get ahead of the coronavirus, the Delta variant. So we have decided, we're working with a young videographer, and we're going to make some YouTubes, if you will, that with several doctors individually talk about what you want to talk about, but you have to end with a couple of bylines. You have to make sure that you talk to people, tell them, encourage them to get the vaccine, and if you choose not to get the vaccine, that you need to follow the CDC precautions. And, you know, we're going to do that. We're going to start with these, and we'll share them and say, look, take these out, put them on your Facebook page, get them to your churches, your local houses of worship, whatever, and family members, and just have them spread them so we can just start spreading this thing. But what we don't have enough out there in this community are enough of our black physician voices saying the same thing. So we're going to start this, and we try this, if it works, we're going to expand the effort and continue going out there. The goal is to have as many voices saying it in as succinct a way as possible, pushing people towards doing the right thing to preserve the African American black people, the community. And we can only do that by making sure that the virus, the coronavirus, the COVID-19 virus does not diminish us.
I like how you think in that when I was younger, there was ABC, NBC, CBS. There was no cell phones.
Right,
There
right.
there were no cell phones. There were no YouTube. There was no TikTok. People had, they would take their time to do things. Now, if it's not 5 seconds, they're gone. How do you deal with that world that we live in now?
Well, it's here, and the tools are there to carry messages. I figure if they can carry nonsense, they can carry sense. So we're going to see if we can create a little bit more sense for those venues to carry. So we're going to use every means we can. We're going to use every willing hand we can find. And we need to get more and more and more people out there doing this. We can save ourselves if we put our minds and hearts to it. It's not that difficult.
Dr. Michael Howell, thank you so much for coming and sharing with us your insight and your wisdom.
Mark, thank you. I appreciate the platform. I appreciate the opportunity. And if I can be of service to help move this forward in the future, please do not hesitate to give me a call.
Will do.
Thank you.
James McCune Smith was born April 18, 1813 in Manhattan, New York. He was an American physician, apothecary, an abolitionist, and an author. He was the first African American to hold a medical degree and graduated from the University of Glasgow in Scotland. As a black man, Smith was barred from earning his degree in the U.S. After completing his education, he returned to New York, where he was a doctor for nearly 20 years at the Colored Orphan Asylum. Smith is perhaps best known as an abolitionist, and with Frederick Douglass, helped start the National Council of Colored People in 1853. Douglass called Smith the single most influence in his life. James McCune Smith died on November 17, 1865. He was 52. That's our show for today. Thank you for being part of it. If you want to join in the conversation, go to Twitter or Facebook at All Things Men BNC. Till next time.